Good afternoon, everyone. Glad to be here at Edmonton's Expo Center, the site of one of our mega vaccine clinics, and we also have rapid testing available here, together with Minister Tyler Shandro, and I'm excited to be here to tell you about Alberta's Open for Summer lottery to help encourage every eligible Albertan to get as vaccinated as quick as possible. Alberta has been one of the leading provinces in Canada for months on the speed and efficiency of our vaccine rollout, and great credit goes out to everybody at AHS and our partners in the 1,340 pharmacies across the province for making that happen, to get jabs into arms to save lives as much and as quickly as possible. The result is that today we have a level of protection in our population that seemed pretty much unthinkable just a few months back. Currently, 2.63 million Albertans, or 68.7% of folks 12 and above, have received at least one dose of vaccine. That's as of last night. We might be inching up to the full 69% today. We're rolling out vaccine doses quickly, and unlike other provinces, we honored the first dose bookings back in February and March, and that's why Alberta continues to lead Canada in second doses administered, with over 20% of eligible Albertans having been fully vaccinated by now. That is great news, and especially for the most vulnerable, our seniors, those over the age of 75. We're pushing 80% that have been fully vaccinated, and that's why we continue to see the rate of COVID fatalities come down, and that's more good news. So I want to thank every single Albertan who's gone out of their way to do the right thing for their own health, for their loved ones and friends, and for our whole province by getting the jab, by sticking it to COVID. You've made the right choice to protect yourself, your friends, and family. We are, because of that, close to the end, and I know everyone can feel it as a beautiful Alberta summer begins, but we're not across the finish line just yet. And that's why Alberta's government is stepping up to get creative in encouraging yet more people to protect themselves and their loved ones with a vaccine through our Open for Summer vaccine lottery. We've seen, and through our Open for Summer plan, which are 3-point plan, we went to phase 2 last week, we have seen cases and hospitalizations decline steeply while opening up businesses and sectors so folks can get back to work. At the same time, we've left some restrictions in place until we hit the trigger of 70% of eligible Albertans vaccinated with at least one dose. And of course, underscoring that number is a lot of people who are immune through antibodies and who have been fully vaccinated. But when we hit that 70% number, that's when we'll be fully open. Because we all want to get to that point and the end of damaging health restrictions, especially with Canada Day coming up fast. I don't know about you, but I am so looking forward to celebrating Canada Day. I certainly hope, as we normally do, with outdoor celebrations in our neighborhoods and communities, backyard barbecues with family and friends, and of course, fireworks to top it all off. But the clock is ticking. If we're to have a fully back to normal Canada Day, we have to hit 70% first dose vaccination no later than this coming Thursday, June 17th. Currently, we are 48,361 first dose appointments away from reaching that goal. We've done what we can to encourage vaccination. We've partnered, as I mentioned, with over 1,300 pharmacies across the province, not to mention the many, many AHS clinics that have been doing rapid flow-through and even drive-through vaccinations. We've delivered vaccines to every corner of Alberta, literally, as soon as they come in, offered free parking and transit tickets for people to get to clinics. We set up temporary clinics to, for example, accommodate the Muslim community late at night during Ramadan, and for shift workers who needed to make appointments outside regular work hours. We've helped Albertans at their workplaces with pop-up clinics in their neighborhoods, with weekend vaccination drives. And we've worked with First Nations, Native Friendship Centers, and Métis groups to deliver vaccines as conveniently as possible to Indigenous people. We vaccinated people in their own homes when necessary, and last week we launched walk-in first dose clinics in 18 communities. We've also spent millions of dollars promoting the life-saving benefits of these vaccines through advertising, including 2 mailers that have gone to every household in Alberta. Despite all of that, we're not quite there yet. And we need everyone who's on the fence or those who want to get a shot but have just been putting it off for a while to get their dose now. We've seen a real drop-off in the past week and a half of first doses administered and bookings being made. We knew going into this that there are some, and there always will be some, who will never get a vaccine of any kind. No fact and no plea to civic responsibility will sway them, and that's just how it is. But we also know that there are lots of people who want to get vaccinated or are thinking hard about it, but they just haven't taken the plunge yet. In fact, in our polling, we estimate that upwards of about 85% of Albertans are open to getting vaccinated. Right now, we're just below 70%. So that is to say that we really need to push hard to encourage the 15% who want to get vaccinated or are open to it, but have not yet gotten around to it. That's 600 and some thousand people. And those are the folks we're really reaching out to strongly encourage them to get vaccinated as soon as possible. So we will step up with our information campaigns, and we'll keep doing everything we can to make vaccines as accessible and just convenient as we can. But we also need to get creative at this point, and that's why we've announced the start of Alberta's Open for Summer lottery. It'll include everyone who has taken at least a first dose, plus those who do so in the weeks to come. If you have not yet got your first dose, then now is the time. By not getting vaccinated, you're not only saying no to the best health protection available, but you're also saying no to a chance to win $1 million. In total, 3 $1 million prizes will be up for grabs in the Open for Summer lottery, and the first draw is just perhaps a couple of weeks away. Starting today, anyone 18 and older who has received a first dose of vaccine at any point, since we started administering them in late last year, anyone who's received at least a first dose is eligible to enter the lottery. And entering the lottery is easy. Just go to alberta.ca/lottery and enter your information. Registration for the first draw will close a week after we reach the 70% threshold, so likely about a week and a half from now. So act now. If you've already gotten a first dose, register online for the lottery today if you want to be test your luck. And if you haven't, then book your appointment now because the clock is ticking. The winner of this first round will be announced on the first day of stage 3 of the Open for Summer plan to celebrate getting life back to normal. But that's not all. First doses are crucial, but second doses matter a lot too. And that's why we'll hold more draws over the summer. The second draw will take place at the end of August. It'll be open to Albertans 18 and older who have been fully vaccinated with 2 doses. Finally, if you decide to get vaccinated after the second draw happens, don't worry. There will still be another chance to win, as the third lottery will be available for anyone 18 and older who has 2 doses and will take place towards the end of September, towards the end of the summer. These draws will award 3 provincial prizes of $1 million each. We'll also be announcing more fun and exciting prizes in the days to come, so stay tuned. Across the United States, lotteries held for vaccinated people are making a big difference in uptake. For example, in Ohio, my friend Governor Mike DeWine introduced a lottery because vaccinations were declining by 25% a week before the lottery was announced. But after, 2.75 million Ohioans signed up and got vaccinated for a shot at the cash and scholarship they were offering, but they saw a 38% increase in vaccination bookings, and especially amongst those groups in the population, like younger men, who had been lagging in terms of the vaccine uptake. So as I said, our polling indicates that about 85% of Albertans either have been vaccinated or intend to get the jab or are open to doing so. That means about 570,000 people over the age of 12 who have not been vaccinated but are open to it. And again, that's who we're reaching out to. So it's very simple. We want everyone to be protected. Get your shots and earn yourself a chance to win big. Now your vaccine shot is also your shot at becoming a millionaire. The time is now. Get your shots and let's get Alberta open for a great summer. And with that, I'm going to introduce Minister Chandra to offer a few more details, and then we'll be happy to take questions from the media.
Thank you, Premier, and good afternoon, everyone. I'm delighted to be here to talk about the Open for Summer lottery, which will help the final push into the post-pandemic life here in Alberta. We've seen COVID-19 vaccines accomplish extraordinary things in this province, and it's only fitting that we respond in kind with a once-in-a-lifetime event. As Premier noted, as a province, we've already won the lottery, the vaccine lottery. Vaccines are safe, they work, we've made them readily available, and they're free to all Albertans who are 12 and over. Now there's an extra reason for Albertans to do some good and maybe even get something good in return. The vaccine lottery gives all Albertans who get vaccinated a chance to win, as Premier said, one of three $1 million prizes. 3 lucky people will not only walk away with life-saving vaccines in their system, but also $1 million each. Now, qualifying for each draw is really simple. You must live in Alberta, you must be 18 years or older, and you must have proof of your first dose for the vaccine for the first draw and your second dose for the second and third draws. Now, this includes the paper record that you received after your appointments, like I did when I received my first dose at the medicine shop, or the digital records that you can find online on your My Health Records account. And just a shout out to everyone in the ministry who's now made My Health Records recently available in the 2 app stores as well, the Google App Store as well as the Apple App Store, so you can have access to My Health Records on your phones as well, or your mobile devices. And as well, you must be able to opt in by registering online. But I emphasize it, you don't have to give proof of vaccination to enter. You only give proof of vaccination once and only if you win. You only need to opt in once to qualify for all of these draws. And anyone who is 18 and older who has received their first dose is eligible to enter. And it's not just for the last 2% to get us to the 70% target for the Open for Summer plan, stage 3 for the Open for Summer plan, as some people have pretended that they think it is. Registration for the first draw opens today and runs until 1 week after we reach the threshold of 70% of eligible Albertans vaccinated with at least 1 dose. And we expect to hit that trigger later this week, so get your first dose and register as soon as possible. The winner will be drawn when stage 3 of Alberta's Open for Summer plan begins. Now, the specific dates and deadlines will be posted on the website once Alberta enters stage 3 of the Open for Summer plan. The results of the second draw will be announced on, as Premier said, on August 31st. And all Albertans who are over 18, who've had 2 doses by August 24th, will have a chance to win in that second draw. The results of that third draw will be announced on September 30th. And all Albertans who've had 2 doses by September 23rd will have a chance at winning. Now, we know that getting 2 doses of vaccine is critical to the best protection against COVID-19, which is why Albertans who've had 2 doses have triple the chances of winning a prize. To enter the lottery, you must register online, as Premier said, at alberta.ca/lottery, and keep checking the website through the summer for updates. We haven't forgotten about those who are 12 to 17. We're exploring incentive programs for young Albertans who are not eligible for these 3 draws. We'll give more details in the coming days. For those who think that $3 million seems a lot, we're spending this money to ensure widespread immunity that benefits every Albertan. Whether you're entering the draw or not, getting the vaccine or not, you are benefiting every Albertan, whether you've entered the lottery or not. And COVID has already cost us billions, and this lottery is aimed at reducing the cost going forward to individual Albertans who are still at risk of getting sick, and to all of us as a province. Now, this is an investment in Albertans and in our province's future. We need to beat the virus once and for all. And like we've done throughout the pandemic, we've watched the real-time results from other jurisdictions as they also, like we do, grapple with COVID-19, including those who've launched vaccine lotteries like Ohio, like California, and several other states, and as well most recently Manitoba. The early evidence is in, and lotteries can help boost vaccination rates. Now we need to make it clear, or we need to clear this last hurdle, and I'm confident that we have it in us to sprint to the finish line. And you can book your first or your second dose appointment by calling HealthLink. That's by dialing 811, or going online through AHS or at a pharmacy. And you can find a list on the Alberta Blue Cross website for the pharmacies. As Premier said, 1,340 of them. Your physician may also be offering vaccinations. So don't wait, get your shot, and get a shot at winning. And together we'll cross the finish line. And so thank you very much, and Premier and I are happy to take any questions. Jerica?
Perfect. Yeah, we'll now go to media Q&A. So 2 questions, either 2 off the top or 1 question, 1 follow-up. We'll start with those in the room and then go to those on the phone. If you could just...
A question for the Premier.
Sure.
If you can just introduce yourself, name and
Graham
outlet.
Thompson, iPolitics. Mr. Premier, good to see you after a year and a half or so face-to-face. An issue that is very dear to your heart beyond the pandemic, of course, is the referendum on equalization this fall. I guess you're aiming this not necessarily at a Liberal government, but at the federal system. With that in mind, have you talked to Aaron O'Toole about this? You've called him an ally in the past, a friend of Alberta. Is it important? Do you want his support? Have you asked him about his feelings on this referendum on equalization?
Well, I certainly briefed him some time ago about our platform commitment to hold this referendum. It was no surprise to Aaron. He knew that that's what Alberta's government was elected to do, and he's very aware of the deep sense in this province that we've been given the short end of the stick by the rest of the Federation for many decades. And that I think he recognizes Albertans have every right to use the political and legal tools at our disposal to fight for fairness in the Federation. And so I know that he'll, I think, respects absolutely our right to do this. And if you want to ask him for more details on his position, I encourage you to talk to Mr. O'Toole directly. But this is something we do, as I said in my speech in the legislature last week, not out of animosity with the rest of the country, but rather to strengthen our role in the Federation. A lot of Albertans don't feel completely at home in Canada right now, and that's a real shame. This is a great country. It's worth fighting for. It can only be strong if there's a strong Alberta, and that's what this is about, is a strong and prosperous future for Alberta.
And just to follow up then on that issue, would you want his support, though? You've called him an important ally on issues like oil and gas, pipelines. This is a major issue for Alberta. You're saying this is one of the big issues facing this province right now. Wouldn't you want to have federal allies on this?
Well, honestly, I've never thought about federal parties intervening in a provincial referendum here in Alberta. I fully expect this will be a topic of debate for the upcoming Senate elections that we'll be holding. I see the first candidate for a Conservative Senate nomination announced yesterday, Erica Barootes, wish her well. And I wouldn't be at all surprised if some federal MPs put their oar in the water to encourage a yes vote on equalization reform. But I wouldn't be expecting federal party leaders to. And I think Albertans will be listening to the debate within the province, not Ottawa, on this particular issue.
Next question.
Hey, Premier, Dan Grummet with CTV News Edmonton. It seems like the impetus for the lottery is about this urgency to have larger gatherings like Canada Day, perhaps the Stampede, and I can see how that would be good for the general morale of Alberta. Is it good for public health, though, to sort of jump into those big events right away rather than a gradual approach, seeing how it goes? And yeah, I mean, is that the best approach for public health?
The impetus for the lottery is to get as many people as vaccinated as quickly as possible. That's the public health imperative. The more people we can get vaccinated more quickly, the safer we all are. And, you know, every day that goes by when we have hundreds of thousands of people that are not vaccinated, it opens us up to a certain degree of risk. We're trying to minimize that risk by maximizing the number of folks who get the jab. And the reality is this: we started to see, we had very strong demand for first doses until about 10 days ago. And we saw it just drop right off. And we were planning, Minister Chandra will tell you, I asked his team to start getting creative about shaking the trees for that last 10 or 15%. I asked them to do that about a month back. We knew a point would come when we would run out of low-hanging fruit in terms of people who were eager to get the jab. And we reached that point about a week, 2 weeks ago. So we're now down in the out days of this week. I think we're down to a week from now, only 1,500 first dose appointments. So now is the time, exactly the right time, for us to start being creative, offering these incentives. It's exactly what these U.S. states did. And I'll tell you, many of the U.S. states that brought in similar lotteries and incentives did so after they were fully opened. After, zero public health restrictions were in place. So this is not correlated to any particular dates or events or the reopening plan. This is all and only about trying to get as many people to step forward as possible. And now, right now, when first dose demand is falling, is exactly the time. We need to reach that 15% open to vaccines, but they just haven't got around to it yet. Hopefully this will get their attention.
Just have a follow-up for the Health Minister, if you don't mind.
For sure.
Minister Chandra, what is your guidance going to be to Albertans after the mask mandate is lifted? Will Alberta Health still recommend that masks be worn in indoor public places?
Yeah, and we made that clear when we announced the Open for Summer plan, that stage 3 would be moving from masks and distancing being mandatory to being moved to recommendations. I think until we get to, I think we have to continue to do the research in other jurisdictions and seeing what the level of community protection a second dose is providing, for us to be able to determine what second dose coverage would be required for us to be, no longer recommending. But I think this is us moving from a pandemic to an endemic, that this is going to, as we move to greater community protection, we are going to continue to live with the virus in our community, and we can do it while assessing our own risk profile as each individual Albertan. And so that's I guess it is going to be moving to a recommendation in stage 3, as we made very clear. For how long is going to be up to the evidence we see in other jurisdictions.
Tom Byrne from Global News. It's for either of you.
Sure, yeah. Sorry, no,
you can hear me? Okay, sorry.
Yeah.
Tom from Global News. The design of this, we spoke to a couple of people where $1 million, three $1 million prizes is great, but did you ever think of, the suggestion was $1,000 prizes to try and farm it out to as many people as possible to really encourage people to sign up?
Yeah, we actually did. There are so many different permutations. There's probably just a million ways to skin a cat, right? And so we did. But we did talk to folks who have that experience in designing lotteries. We talked to folks at the AGLC. We talked to folks who are involved in designing and being consultants in administering vaccines. The feedback that we got and the recommendation was from those different groups and agencies was to have, if we had 3 prizes of $1 million each, then that was going to be enough for us to get enough folks to register for this lottery. Premier?
Next question's for the Premier. It's on a different topic. It's one we spoke.
If I could.
Sure, of course.
Just point out, Tyler just upset the feline lobby with that skin a cat remark. But also, yeah, we actually, I think Tyler said this, I couldn't hear back there, that we did consult lottery experts, and this is what they recommended. The big prizes get more interest. And also in the response to the CTV question, I'll just point out that 2/3 of the prizes are in end of August, end of September. So we're staging this. It's not all about the immediate opening. It's just about getting as many people vaccinated as possible. Tom, go ahead.
There are reports that another woman wearing hijab was attacked in North Edmonton. It's being investigated. Obviously, your government made announcements last week about protection, the liaison, the task force. At what point do we need to look at the laws on the books and to ensure that the laws on the books are where they need to be? Do we need to have that conversation?
Well, first of all, we condemn without equivocation any attack of hate. These are not, any act of violence against a fellow citizen is outrageous and should carry the full weight of the law, but to have the added malice of targeting someone because of how they look or what they wear is outrageous, and I expect that the Edmonton Police will lead an investigation and lay charges if they can identify the culprit. And we, as you know, last week announced a hate crimes coordination unit, as well as a community liaison on hate crimes through the alert team, which brings together all of the different Alberta police agencies to make this an enforcement priority, in addition to the security infrastructure program to provide grants to vulnerable community institutions that may be victims of vandalism or violence. In terms of the criminal code prohibition, there are strong laws against assault of any kind, and Canada has strong hate crime laws in place. Those are under the federal power. That's not something that Alberta can legislate on directly. And I think the Prime Minister did say the other day they were going to look at whether there's need to strengthen any of those laws. I was a part of a government that brought in mandatory minimum prison sentences for various kinds of offences. The Trudeau government has largely weakened those. I would invite them to go back and look at that, for crimes of this nature, where a court finds that there is an intention to commit a crime for reasons of hate, and that is determined to be an aggravating factor. I would personally support a mandatory minimum penal sentence for that, so that people don't go through the revolving door, because if it's a, quotes, minor assault, by the time they get a discount for their penal sentence based on time served, and then they get automatic release, and they get all sorts of other, and a slap on the wrist style sentence, it's not a very strong, it's not a strong disincentive. So I would look at that. I would look at mandatory minimum prison sentences for violent hate crimes.
Okay, we'll now go to those we have on the line. Operator, can you please put through our first caller?
James Keller, Globe and Mail.
Hi, Premier. How concerned are you, looking beyond stage 3 and the 70%? I mean, how concerned are you that Alberta won't be able to push these numbers much higher than 70%? Right now we've got 59% of the total population. And what would that do if we stayed at these sort of comparatively low numbers to Alberta's long-term ability to keep COVID at bay?
Well, look, we're optimistic, and that's what the whole plan is predicated on, the plan that was developed by Dr. Hinshaw and her public health team, based on real-world experience across the globe. Texas opened up completely on March the 6th, 0 restrictions, at 15% first dose coverage, and their numbers have continued to drop. It hasn't disappeared, but in Florida, most U.S. states have lifted all restrictions at lower levels of vaccination coverage than we have. And generally, as you can see, their numbers have continued to drop. Now, I think what you are seeing in the U.S., where they seem to hit a wall at about 45–50% vaccine coverage, is that the vaccine is affecting those pockets of the population who are not vaccinated. But not in a way that that threatens large-scale fatalities or jeopardizes their healthcare system. As Dr. Hinshaw has said, COVID is not going away. It's not going away at phase 3. It will probably continue to be a healthcare issue for many years to come, just like the Spanish flu was for 30 plus years after its deadly phase. So we can expect to see COVID and different variant strains ricochet around the world and around our province for years to come, just like other contagious diseases do. But as Dr. Hinshaw says, we will deal with them as an endemic and not as a pandemic, because with anything like 70% population protection, that mathematically reduces to almost nil the chances of exponential growth. So we've never been chasing after 0. People will continue to contract COVID. There will be seasonal spikes. I guarantee you there will be one this fall, probably starting in mid-October. And Some of those people will end up in hospital. Sadly, some of those people will pass away, just as we have dozens of people who die every year from the conventional flu influenza. These are different diseases. COVID is more dangerous, but we also have much wider protection in terms of vaccines. So, look, based on the real world experience, I know that there are some, look, I read a lot of the data about what's going on around the world. There's a handful of countries with relatively high levels of vaccination, Chile, Uruguay, Seychelles, a couple of others that have seen spikes in the last few weeks. Those countries all have in common that they went very long on the Sinovac Chinese vaccine, which apparently is much, much less protective than the mRNA vaccines, which have been the mainstay of our program in Alberta. Many of those jurisdictions also completely lifted public health measures prematurely. We still have strong measures in place right up to now. And many of them have much larger populations that are living in high housing density and poverty, which is obviously another risk factor. The only other thing that we're watching with concern is the B1617/Indian Delta variant. And I'm very encouraged to see a study that was published an hour ago in a preprint by Public Health England, which takes a look at all of the identified B1617 cases in the UK and has concluded that after the first dose, Pfizer is effective and at 94% at preventing hospitalization, AstraZeneca 71% at preventing hospitalization, and after a second dose, Pfizer 96% and AstraZeneca 92% effective at preventing hospitalization, which is why, you know, they've got that variant running through the younger population that was not vaccinated, but it's not affecting their hospitals to date.
James, do you have a brief follow-up?
Definitely. So you pointed to the UK. I mean, they just today are delaying their reopening plans by, I think, a month. Higher vaccine coverage there. For first doses, it's slightly above Alberta, considerably higher for second dose coverage. So again, what do you think about what's happening in the UK right now? And does that give you any pause at all about the speed with which Alberta is proceeding right now?
We took different paths, and obviously they had a multi-month head start on us in terms of supply. We're catching up. And we've now Canada has exceeded every country in the world with the exception, every country on first dose coverage. We're catching up very quickly on second dose. Alberta's leading Canada at second dose. I think we'll be at 25% of our adult or our 12 plus population having had their second dose by the end of this week, which is very considerable. Most importantly, that's amongst the most vulnerable part of the population, the elderly and people with chronic conditions. That radically reduces chances of hospitalization, which is our central goal. The problem with B1617 in the UK is they did not vaccinate younger people at all. And until very recently, they only 10 days ago, I think, started vaccinating people under the age of 30. And so you had, children, teenagers, and 20-somethings, a huge chunk of a third of their population that had not had any coverage. And those age cohorts socialized with each other. So there was no barrier to viral spread in those age cohorts, whereas 50% plus of our 12 to 30-year-old Albertans are vaccinated. So there's a much bigger barrier to viral transmission in those age cohorts. Secondly, UK's mainstay on the vaccine program has been AstraZeneca, whereas here in Alberta, it's been a relatively small share. The lion's share of our vaccines have been mRNAs, which are proving to be more effective, particularly on first dose against that particular variant. We keep an eye on it, but I know we were just talking to Dr. Hinshaw about this a couple of hours ago, and we remain confident about the prudence of Alberta's plan.
All right, we have time for 2 more questions. Operator, can you please put through our next caller?
Don Braid, Calgary Herald.
This is just a quick question about the lottery. Is there any way a person can, I'll ask it this way, do you have to have your vaccination a week, 10 days before the draws? And what I'm getting at is there any way a person could find out they won the thing and then race out and get a vaccination, which is really not much of an incentive to vaccination. Could you explain that?
Yeah, at each stage, Don, the eligibility cutoff to enter the draw will be about a week before. the draw happens. And then, good question, Tyler. What if they get drawn and then they run out to get proof of vaccination? I think we're going to allow that. I mean, the point is that right?
Well, good question, Don, because we're not asking, and we wanted to make administration as simple as possible, and we didn't want to be collecting personal health information in the first instance when people were getting, and maybe third reason, we didn't want our public health folks, like in the Expo Center, trying to collect consents, and many of us have already had vaccines without consent being collected to be able to enter into the lottery. So the easiest thing was for people to just enter with a minimal amount of information, and if they're drawn, then for them to be able to prove that they've been vaccinated. Good consideration, do we have to show that when they show us with my health records or their paper record that they had it the day of the cutoff? That's a good question. We can get back to you on that, Don.
And Don, do you have a follow-up? Don, are you still on the line? Okay, going through.
No follow-up, thank you.
Thanks, Don. Operator, can you please put through our last caller?
Marie Chabot-Johnson, Radio Canada.
Hi. Donc, en français pour le Premier ministre Kenney.
C'est Chabot.
Oui, merci.
De rien.
Pourquoi pensez-vous que la loterie sera suffisante pour augmenter le taux de vaccination pour des gens qui étaient déjà hésitants à la base?
Écoutez, selon nos sondages, il y a 85% des Albertans qui ont reçu les vaccins ou ont l'intention de le faire. Mais ça veut dire qu'il y a presque 600 000 Albertans qui sont ouverts à l'idée de vaccination, mais qui n'ont pas déjà reçu le vaccin. Maintenant, il faut les encourager et d'être créatifs à cet égard, comme plusieurs États aux États-Unis ont fait, pour donner à ces personnes-là un sens d'urgence qu'ils pourront perdre $1 million s'ils n'agissent pas maintenant. Alors, nous espérons que ça va marcher comme c'est fonctionné dans certains États, où on a vu une augmentation importante dans les nombres des personnes qui se sont présentées pour les vaccins.
Did you have a brief follow-up?
Oui, la loterie s'adresse aux 18 ans et plus. Comment comptez-vous améliorer le taux de vaccination chez les 12 à 18 ans?
On va augmenter nos campagnes de publicité. Il y aura de renseignements envoyés à chaque foyer, à chaque famille en Alberta prochainement. Il y aura les efforts ciblés. Particulièrement, nous nous inquiétons de la situation en ce qui concerne les vaccins dans les communautés plutôt rurales, où il y a un taux de vaccination beaucoup plus bas. Alors, il y aura les efforts ciblés à cet égard et autres prix que nous allons annoncer. Mais écoutez, nous avons vu une diminution considérable dans la demande pour les premières doses. Alors, les choses deviendront de plus en plus difficiles, mais on va lutter pour chaque autre personne d'être vaccinée. I'll maybe just say a bit of that in English to say that, this is not the only thing we're doing. We're going to step up our advertising and public awareness campaigns. Every Alberta household will be receiving an informative mailer responding to some of the misconceptions about the vaccines in the next few days. We'll also continue with targeted efforts. We were seeing last month, low uptake in the upper northeast of Calgary, but I'm pleased to report that working with community partners and doing some making vaccines more convenient up there, that upper northeast Calgary has caught up with the whole city. That's the kind of success that we can have with targeted efforts. We're going to increasingly focus on some of our rural communities where we've seen low uptake with information that's relevant to them and making things more convenient. Continue to work with First Nations, for example. But there's no doubt that growth in that number is going to slow. It's going to be a lot slower than it was in the last 2 months. We've gotten the low-hanging fruit, and now it's a game of inches. We just have to get every single person we can We think that many of the holdouts, that 15% I keep talking about, many of them are younger men. They are typically not opposed to the vaccine. They say they're likely to get it, but I don't know, they've got busy lives or it's just not a priority. A lot of those guys probably don't worry too much about their health. We just need them to get a sense of urgency and be creative in bringing them into the vaccine clinics and the pharmacies. So thank you very much.